Good afternoon, everyone, and no pressure on me after Duncan's introduction. You're all very welcome, and today really I want to cover two main things with you. I want to help give you an understanding of what's happening in the minds and the bodies of your employees, which might make it more difficult for them to engage with you in a process in relation to stress management. And then I also want to look at what organisations can do in terms of prevention as well as from an occupational health perspective to maximise, as we say, employee health and try and prevent as many cases of work-related incidents of stress. Okay, so if we just start with some cartoons. So I create a stress-free world for myself. I feel more secure each day. So if my head's in the sand, that's a good way to avoid anything. And you thought there was stress in your life. It's not denial, I'm just very selective about the reality I choose to perceive. Okay, so let's just think about stress and pressure for a moment. So on a show of hands, how many people think I'm probably going to use the analogy now of the glass half full versus the glass half empty? Yeah, so a lot of hands. Let's look at it a slightly different way. How much do you think the glass weighs with the water in it? Just in terms of hazard and a few guesses. We say 200 mils, 250 mils, roughly? Yeah, have we kind of agreement on that? Okay, let's look at it differently. It's not about the weight of the glass. The weight of the glass actually doesn't really much matter. It's how long I hold it for. So if I have to hold this glass up like this for a minute or two, it's not really going to have any effect. If I have to hold it for a day or two, it's going to have more strain on my wrist, my hand, my arm. If I have to hold it for 2 weeks or 2 months or 2 years, it's going to cause physical problems and physical ailments. And the stresses and the strains people feel in their everyday lives are pretty similar to the concept of the water in the glass. Stress is a good thing in terms of it can take us out of our comfort zone and stretch us. But when we're holding stress and pressure for a prolonged period of time, that's when it causes the pain and the discomfort and the issues that it causes you as employers and your organisations. So I think it's important for you to, as employers and organisations to look at it that way, and particularly if what you're doing in your organisation at the moment isn't working, then you need to look at doing something differently, and we'll talk more about that throughout the presentation. So as I said, stress is a fact of life. So, you know, we need a certain amount of stress, we need a certain amount of pressure to perform. So for our peak performance, for our productivity, both in our personal lives and our work lives. What happens when employees are in a state of perceived prolonged stress is when the balance of the scales tip. So the demands are up here versus their perception of the resources being down here. And that's what actually tips the balance, and that's then what causes you problem in your organisation. So I just want to look at the pressure performance curve just to show you really, I suppose, the stages of events that can occur. So first we have boredom. Now, employees in the boredom part of the pressure curve probably come in, they do the minimum that's expected of them, they show up most of the time, but they don't really kill themselves. They don't really go over and above in any aspect of their role. They have maybe the technical capability and competency to carry out the tasks, but research actually shows that employees in the boredom end of this curve will cause you as many performance issues as employees in the strain end of the curve. So that's an important point. Our comfort zone then is where we all like to be most of the time. So it's where we know we have the technical ability, the competency, the experience, you know, we have enjoyment within our jobs, we're getting things done and we're getting things done well. Now, where the ideal is if every so often we're in the stretch. So we take ourselves out of our comfort zone. So maybe to meet a big tender deadline or to release a new product or service to the market. That's when you want employees to stretch a little bit and come out of their comfort zone. And actually the stretch, or the comfort to stretch, is actually where, if you look at it, they're probably the peak performers in your organisation. Then when we have prolonged stretch, if you like, that's then when it can start to affect both an employee's mental health and an employee's physical health, and they come into the strain part of the curve, where things within their mind start to change, things within their physical body start to change. And I'm going to talk about the physiological process because I do think it's important for you to understand that. And once we're in the strain stage for a prolonged period of time, ill health is inevitable. So a decline in the person's physical and mental health is actually inevitable at that point. So that's another reason why recognizing the signs early and acting on them early is actually so important. So let's take a little look at what's actually happening, the physiological reactions that an employee has when they're stressed. Now, while I don't want this to become an anatomy and physiology lesson, I do feel it's important for you as individuals and organisations who are managing stress to actually have an understanding of what's happening. Because sometimes our attitude to stress, and I've seen it in 15, 16 years of occupational health, in some organisations it'll be, you know, why doesn't Emery just get on with it? This is all in their head. I just don't understand it. So yes, actually it is all in the head, but that affects other things. So if we look, first of all, we have three main areas of the brain responsible for the stress reaction and how we deal with it or how we don't deal with it. The hippocampus, the amygdala and the hypothalamus. Now the hippocampus is the area of the brain that sits around here, and that's the area of the brain that controls how we process memory. So it takes the information that we get and takes the context of the information we get. So we're told it, we hear it, we learn it, we're taught it, we see it. And this is going on from your childhood. So you could be dealing with issues that somebody has pre-programmed in their head from 2 and 3 years of age. And the hippocampus takes that information and it stores it into our short and our long-term memory. The problem with the hippocampus in a stress reaction or in someone who has a perceived stress reaction, and that's another really important word, perceived. So research shows that stress is what I think it is to me. It doesn't matter what my boss thinks it is, it doesn't matter what my colleagues think it is. So stress is an individual perception, and unfortunately that's something that you as organisations and employers have to work with. So the hippocampus is extremely vulnerable and perceptive to the stress hormone cortisol, which we will secrete in a period of stress. Now, in a short-term stressful period, the cortisol actually serves to give us our fight and flight and allows us to perform. But when cortisol is over-secreted for a long period of time, it wreaks havoc in this area of the brain, and it reduces the connectivity of the neurons and the functionality of that area of the brain to the point where it cannot function anymore, and an employee will have extreme difficulty taking in new information. So that's going to make it very hard for you in your communication processes with that employee. Now, almost as soon as that happens and the hippocampus shuts down, the amygdala kicks in. And the amygdala are two tiny organs the size of almonds, the shape of almonds, that cause you guys as employers a hell of a lot of problems. The main reason being that the amygdala activates our fear response. So it's the area of the brain that is responsible for our decision-making capacity, our memory recall, and it activates a negative response. It activates a fear response. The left side of the amygdala can activate both positive and negative, but unfortunately in a perceived stress reaction where cortisol is wreaking havoc around here, it will program the right side of the amygdala, which is what produces our negative response. And it will seek to allow and to encourage that person to avoid fear-inducing stimuli. So they will avoid things like the meetings in relation to their performance, possibly the occupational health process, the EAP. And that's something that physiologically is happening in their brain, and it's happening whether we like it or not. So the hypothalamus kicks in at this stage because it's the control center of the brain. So it's roughly here. So it senses the hippocampus is shut down, the amygdala is working overdrive, and what it does is it initiates the fight or flight response. Just one other important point about the amygdala, there's a lot of research to show that the amygdala is also, when it's in activation, that it's responsible for addictive patterns of behaviour. So you may have an employee who becomes dependent on food, dependent on alcohol, dependent on drugs. So the amygdala is the part on a Friday evening when you go home after a really stressful week that tells you it's a really good idea to have a bottle of red wine. It's not the part of the brain that says, Anne-Marie, what you should do is get an injection of serotonin, and a really good way to do that would be go out for a 30-minute run. So it's important, you know, in terms of negativity, that's another thing it does. Okay, so our hypothalamus is now in action and it's told our nervous system we're in trouble and we need to fight. Two things happen at that stage. The body starts to over-secrete adrenaline, and that's what allows us to fight. Okay, so the heart rate goes up, breathing rate goes up, metabolism goes up, and it also increases the metabolism of glucose, and that's designed to give the body energy. And this happens in a part of our nervous system called the autonomic nervous system, which means it's automatic, it's not under our conscious control. So there's nothing we can do about it. This fear response and this sequence of events will happen whether we like it or not, whether we as the individual who's perceiving the stress or whether we as the employer want it to happen that way or not. And all of that is controlled by this cortex at the front of the brain here, and that controls our behaviour and our personality traits. So that's why you could have 10 employees with 10 different stresses that they perceive, and you will have 10 individual reactions and behaviours within those 10 employees, because genetically all our prefrontal cortexes are different. So I think it's a really important thing for you just to keep in mind in terms of trying to manage the employee and the difficulties that you might have with keeping that employee engaged or getting them engaged in the first place. So it's usually not, a lot of the time, it's not that the employee doesn't want to engage, it's simply that they don't have the physiological capability to do it when they're in a state of perceived prolonged stress. So if we just move on in terms of what research shows are the factors that come up for employees most often and most of the time. Biggest stressor is usually communication, poor communication, aggressive communication, lack of communication, or sometimes over communication. So again, what we were talking about, what Alva talked about with the emails, so a constant flow of communication that's causing a problem. Lack of reward or recognition. The single biggest threat to an employee is not feeling valued and not feeling secure. And the main reason for that is that psychology research shows most human actions and interactions are programmed by fear. And one of the reasons being what we talked about just a couple of minutes ago. The workload versus the time management. So that it could be, you can't manage time, you can only manage yourself. So that could be an issue in an organisation. The person's knowledge and expectation of what goals and what's expected of them. A lack of responsibility or control, so where they feel they have no responsibility or control over a finished product or service or end result. The physical conditions, the threat of violence, of bullying, economic uncertainty, political uncertainty, understaffing, under-resources, lack of technical or physical equipment. So these are all the things that cause a problem. So the first thing I would encourage you all to do when you leave here today is look at your organisation with a bird's eye independent view and look at what is not working. And if there's things that aren't working, they need to work better and they need to be improved. If there's things that are working well, is there a way that they could work better? If what we're looking at isn't going to change and the stresses and strains people feel in their everyday lives versus that physiological response that I'm talking about isn't going to change, therefore we need to change the way we look at it. So if we keep doing what we've always done, we'll always get what we've always got. So just now I want to go through key kind of things that you can do from an occupational health perspective and things that I would have helped organisations put in place and seen organisations put in place over my years as an occupational health advisor. So as I say, first and foremost is the culture of the organisation. You need to look at what your attitude is in relation to stress and how your employees perceive their work environment, because if they don't perceive it positively, you're not going to have positive outcomes and you're going to run into litigation type issues. So the Work Positive tool is a tool by our Health and Safety Authority, and it looks at kind of 6 main areas. So you can download this for free, you can upload all of the results for free, and you can actually get a very effective report as to what's not working in your organisation. So it looks at things like demands placed on the employee, the control systems in place, the support, the relationships, the roles of the employee, and then any change in the organisation, which we've all had over the last few years in the worst recession our country has ever seen. So it asks the key questions and it asks the employees to rate their responses on a scale of 1 to 5, with 1 being high risk of stress and 5 being low risk. So you want to be aiming to have it in the higher numbers, and then it will quantify in relation to the results it gets. So it looks at things like morale, turnover, communications, feedback, technology, support, management styles, etc. All of the key things that we looked at there and factors that control stress. If you don't want to use something like by the HSA, you can develop your own independent tool online, something like through SurveyMonkey. And A very, very under-resourced thing that I would see is that not enough employers and organisations look at this at a pre-employment stage. So when you think of the cost of recruiting an individual, for €35, you can put that person through an online pre-employment questionnaire, which is maybe much less invasive for an employee's perception than going for a full medical. Particularly in roles where we see that there's going to be high performance expected or tight timeframes, tight targets, deadlines, where it's a responsible role. If we see anything in relation to red flags with that employee's mental health, so they've had any history of anxiety, depression, panic attacks, if we see anything in relation to their physical health, have they had a heart attack or do they have high blood pressure? Is that going to be something that maybe causes a problem? We can do a phone interview with the employee and we can also get consent to contact their GP and if they are under any other care of any other consultant. So it's really important that you know what you're taking on before you take it on. Another thing a pre-employment will address is sickness absence. So if you have somebody who's said in the last 4 years they haven't had one day off sick and 6 months into it, they've been off for 10 days with you, then there's an imbalance there and we can ask the right questions from occupational health. And other cultural things that you can do. So the Great Place to Work survey, that's where we put the nice things, the wellness pieces in place that look at overall employee health and well-being. And A&L Goodbody are a fantastic example of that. They've won awards for their Great Place to Work initiatives, which is brilliant. So, look at what the culture of your organisation is. Is it a just get on with it? Is it, that you give them any form of health screening, wellness screening, any other programs, or is it just simply when you're out sick, you're sent to the nurse or the doctor? And what is the required level of stress that the person should be able to handle, as Alva said, in each of the different positions in their organisation? And if people do bring challenges to the table, what way are they viewed? Are they seen as a challenge? Are they seen as a whinger and a moaner? Are they seen as a proactive employee who's looking at it and being honest? So, or is it a case of, okay, well, I'm really starting to cause a problem, so it's time to get rid of her? So just look at what the attitude is within your organisation. Secondary then would be the training and support. So if I were asked what is the biggest mistake I see organisations make in relation to stress in the workplace, it is that they ignore it when it's happening. They ignore the early warning signs, the red flags, the signs and symptoms that will be there. And it's really important that your managers who manage your people on a day-to-day basis and probably have more interaction with them than you might as the employer, it's really important that they know what signs that they need to spot. So usually there'll be behavioural changes, maybe changes in someone's temperament. It could be aggression, could be introversy. There might be changes in their physical appearance. There might be changes in what they get involved with. There may be performance issues. And the worst thing an organisation can do are ignore those early warning signs and not manage them, hoping they'll go away, because they won't. If you look at the physiological reaction that's happening in the brain, the amygdala has kicked in and that is not going to go away all on its own, where an employee perceives they're in a prolonged state of stress and their body is pumping cortisol. It's just not going to happen. And then in terms of feedback, are they getting both positive and negative feedback? Okay, you're employing people to perform, you need them to perform, but you also need to look at how can you do it in a positive, more supportive way. And then the communication and the management styles. From an occupational health management then point of view, if your managers are recognising the signs and symptoms early, the best port of call in the first instance is an informal chat. So Anne-Marie, we value you, we value your role here, we value your opinion. I've noticed recently that there are some changes, is everything okay? And that can sometimes be as much as it needs. And that can allow your managers to follow on with a referral to occupational health. So we have a nurse on site or we have a doctor on site. Would you go and speak to somebody in occupational health? And you can also refer them then to an EAP if you have it, which I would advise organisations at a minimum should have an EAP, because at least it gives you some form of independent care for the employee at a fairly minimal cost. So occupational health and EAP should be instituted very, very early on, and if your managers are spotting the signs, they should be making the appropriate referral. And only then, if the employee is not engaging, should it go down the route of the formal discussion, where you're saying to the employee, Anne-Marie, it's your duty of care under legislation. These things are in place for your safety, health and well-being, and there is an expectation that you will take them up once you've been referred. And it's fine to have that formal discussion once you're at that stage of the process. And then only at the end stage should it be a performance improvement programme. And if you were to ask me the second biggest mistake I've seen organisations make in my 16 years doing this, I would say what they do is they let it go unmanaged, they ignore it because they don't have the courage to actually stand up to it. They wait until the performance comes to a point where they have to address it because the person has become dysfunctional or may be causing dysfunction in the team. So they take someone whose amygdala is in overdrive, the hypothalamus is going bananas, they're pumping out cortisol, they don't know whether they're coming or going, they can't rationalise, they can't make decisions, they can't take on new information. And what do? You stick them on a performance improvement programme. And you wonder then why they go to their GP and they say, I can't take any more. Or they go to their solicitor and they say, I'm being bullied, I'm being harassed. So just be careful in terms of where you implement the performance improvement, at what stage, and what supports have you given the employee up to that point, because that is really important in relation to litigation cases. And then what not to do. As I say, the biggest thing not to do is ignore the signs and unmanage them and hope they'll go away all on their own, because usually they don't. Now, in some situations, maybe where stress is related to grief, then yes, or maybe stress is related to postnatal depression or something traumatic that has happened in an employee's life. Where it's something like that, with the support of EAP, very often you can get an employee back to full capacity fairly quickly. But it still needs to be managed, and it still needs to be managed early. And then from your occupational health referrer, whoever you refer it to, be it an external company, something like ourselves, or if it's an internal, you have an in-house resource, ask the right questions. I see some occupational health reports through legal cases I've defended, and I just think, what planet was that person on writing it, and what planet was that HR manager on accepting that as a report, because it's woolly and it says nothing. You are not paying the nurses or doctors in occupational health to sit on the fence. You're paying them to give you an opinion. And again, it's like every profession, you will have some people who are better at it than others. And sometimes there is a fear by occupational health of putting it down on paper because you have to stand over it. But as the client, that's what you're entitled to. That's why you're buying in the expertise of their service. So the biggest thing you need to do is give a clear job description. So if I'm the occupational health nurse reviewing the employee, I need to know what is the employee's role, and I need to know every aspect of the role so that I can assess in relation to pressure, what would be an acceptable level of pressure and what other factors might be involved. I need to know if there have been previous performance issues. I need to know if there's been previous absence issues. I might need to know, is there any non-work related issues? So it could be something completely out of work. Don't confuse the work-life balance with work-related stress and non-work related stress. Stress is stress. My body doesn't say when I get in the door home at 6 o'clock on a Wednesday, Anne-Marie, you're home now, you're not stressed. It doesn't work like that. Or it doesn't say, Anne-Marie, you're in work now, you are. So, look at external things as well. Or have there been changes in the role, changes in the support structures, changes in the organisation, changes in the team? Change can be a big fear-inducing stimuli for an employee who perceives they're in a state of stress. And ask for an expected time frame in relation to their capacity to come back to work. So an easy way to ask it is it likely that this employee will return to work in the foreseeable future? And by foreseeable future, we're talking roughly a period of 6 months. Now, any occupational health professional who's worth their salt should be able to make a yes or no comment on that. And if they're not, I would suggest looking for a different provider. And once you know then if they are able to make a return to work in the foreseeable future, in what capacity? Is it going to be a phased return? Is there 70% of the job that they can do and maybe 30% that, okay, we need to build this up? And where you can, I know, and it's definitely a difference I would see between Ireland and the UK, where in Ireland there's this black and white, where they're either fit or they're not fit. If they can't come back and do everything, then we're really not interested. Whereas in the UK, it's very different, and even the case law in the UK would say the same. You have a much more successful likelihood of getting an employee back to full capacity if you keep them engaged in the workplace. So if they're able to do 50 or 60 or 70% of their job, and it's anywhere technically possible for you to implement that, my advice would be to keep them in the workplace as much as you can. And then you want to know in the report, are there other interventions? Are they engaging in the EAP? Are they going to their GP? are they seeing any kind of consultant, like maybe a psychiatrist? You need to know if the occupational health referral person needs to know what other intervention is being taken, and then what roles would they be fit for, and get them to prescribe the return to work for you. So, get them to give you the information. And again, accepting things like light duties. What does that mean? How many times do we see light duties on a cert? Don't accept light duties. You've given a specific job title with roles and responsibilities. Get the occupational health nurse or doctor to prescribe the specific duties they feel are light. So don't accept light duties. You can do nothing with a report like that. And in cases then where it does go to a litigation stage, if you've made a wrong call on what you perceived as light, then you can run into more problems. So don't accept terminology like that. One of the things that's in your pack is a feedback form, which I'd like you to fill in, and what you can do is put your details on it. One of the things that we do is that we will review the strategy within your organisation for work-related stress and your occupational health. It's a no fee, no obligation consultation. My details are there, and they're also on the feedback form in your pack. So please feel free to give me, we'll obviously do the questions and answers, but please feel free as well to give me a shout if there's any other issues that I haven't addressed that you would like further guidance on. So thank you very much. And I'd like to introduce Ciara. Thank you.